the NAMI Yavapai and the Northern Arizona Peer and Family Coalition meeting today, and I am also admitting people for you, Lori.
Thank you, Kathy.
So welcome.
Okay. Thank you, Kathy, for that. And thank you, everybody, for being here. I sent out a flyer with a brief bio and a picture of our panel members, but they had more in their bios than I could fit on that. So I'm going to just go over for you to be sure that you know who the panel members are. I'm going to start with Doug Dolan. Doug is a co-owner and COO of Recovery in the Pines. That is a long-term substance abuse and mental health treatment program. He's been with them since 2012. He sits on the board of directors for MatForce. He is the MatForce's OD Fatality Review Board and Speakers Committee. He's a public speaker on various aspects regarding mental health, substance abuse, and trauma. He sits on multiple other committees focused on substance abuse, mental health, families in crisis, brain health, and suicide prevention. In October 2021, he was one of 12 people and the only person in the treatment community selected in Northern Arizona by the DEA to participate in their first Citizens Academy. Doug has been sober since April 19th, 1997. He lost a younger brother to a drug overdose in March of 2008 and lost his best friend of 30 years to suicide. He is a passionate advocate for healing, wellness, and life transformation. Thank you, Doug, for being here.
Yeah, I'm very grateful. Thank you for giving me the opportunity. I love working with other people. None of us do this alone. And I always love learning from other people as well and understanding what other kinds of resources are out there that I may be able to put into service of other people who are struggling.
Okay. Next, I'd like to introduce Stacy Coe. Stacy, as a parent, plant nerd, dancer, and one of the original members of Sonoran Prevention Works team. After graduating from ASU in 2012, they worked in just about every sector of social services they could, seeing clients, friends, and coworkers die from preventable overdose deaths again and again. They knew that there had to be a more expansive, nuanced, and compassionate way toward recovery and healing. That is when they founded SPW, or when SPW found them. Stacy sees harm reduction as an invitation to more feeling, more dignity, and more choice. You can catch them resting, exploring libraries, talking to plants and birds, and leaning into play with their magical kid. Welcome, Stacy. Next, I would like to introduce Paula Landis. Paula is the HIV, HCV, and substance use risk reduction and education outreach program manager at North Country Healthcare, where she plays a pivotal role in promoting health and wellness in underserved communities. Residing in Lakeside, Arizona, Paula brings over 17 years of personal sobriety experience, complemented by a family legacy of more than 60 years of sobriety, fueling her dedication to overdose prevention, treatment, and support. In addition to her work at North Country Healthcare, Paula is an accomplished small business owner specializing in recovery and treatment facilities. She's also a mentor for the Mamas program with the Recenter, where she guides individuals on their recovery journey and serves as a women's ministry and worship leader at her local church. Born and raised in the White Mountains, Paula is deeply passionate about enhancing social and community resources in rural areas. She actively collaborates with various county health departments and engages with multiple community committees to address the unique challenges faced by these communities, demonstrating her unwavering commitment to making a positive impact. Thank you, Paula, for being here. Next, I'd like to introduce Lou Funk. After the preventable death of a close friend and colleague in the desert, Lou Funk started the Mobile Harm Reduction Program that would come to be known as Cochise Harm Reduction. This program was born out of a pressing need to meet people where they are at and pay regular visits and provide consistent assistance to the most vulnerable members of the community. Lou's driving force lies in dismantling unjust systems of harm and dominance while fostering community-oriented networks of care and solidarity. Their love for people who use drugs fuels their dedication to advocacy, a role they hold with deep honor and commitment in the community. Lou has been in the role of executive director at Cochise Harm Reduction since 2021. Cochise Harm Reduction Outreach Program served over 6,000 people in Cochise County in 2023. Welcome, Lou. Last but not least, by any means, we have James Tobin. James is a 25-year veteran of law enforcement in Yavapai County. In 2009, he was named the Manforce Yavapai Substance Abuse Task Force Community Member of the Year. In 2012, he received the Mickey Sadoff President's Award from the National Office of Mothers Against Drunk Driving. In 2018, he received the Enrique Kiki Camarena, award from the BPOE Elks U.S. Drug Enforcement Agency for career-long drug awareness and prevention efforts. In 2018, he received an Excellence in Prevention Award from the Arizona Department of Liquor and Licensing. And from November 2021 to September 23, he was Director of Alcohol and Drug Prevention Strategies at Yavapai College. Since September of 2023, he has served as a section manager over substance abuse and mental health programming at Yavapai County Health Services in Prescott. He has a BS and an MPA in public administration from Northern Arizona University. And his proudest accomplishment is being a husband to his darling wife and a father to his wonderful children. So welcome, James. Welcome, panelists. This is, our topic is about prevention, overdose prevention. And all of our panel members are working daily with that. So with that, let's turn it over to the panel and I'll just kind of open it up. And I think that we'll hear that some of you are doing similar things and some of you are doing other things. And in past experience with panelists, there has sometimes been an offshoot where they decide to form their own coalition and get together. And then that has expanded statewide. So you never know where it's going to go. But I'd like each of you to just say briefly where your organization is and highlight the aspects of prevention. And I'll just go down the list as we have you listed on our flyer, starting with Doug.
Located in Prescott. And as you mentioned earlier in my bio, we've been doing this since 2012. We only work with adults, so the 18 plus community. And since our beginning, I've seen anywhere from 18-year-olds to 77-year-olds, and with a wide variety of different drugs of choice, as well as other mental health behavioral issues. One of the consistent things that we've seen is needing to get to shame. Gabor, if you're familiar with Gabor Mate, his premise is that everybody who has an issue of addiction has trauma. I disagree. And I disagree only in the sense that I don't have trauma from my past, but I do have a lot of shame. And if somebody didn't help me get to that shame and work on that shame that I was carrying around and what that created as far as a negative narrative in my head, I would likely still be going out doing what I did before. And so when we work with clients, we're working with them mentally, emotionally, physically, spiritually, socially, and taking a look at the different factors of how issues of addiction have changed them over time, And it isn't just about stabilizing them and then giving them some education. That's a great start, but that's not enough. Then it's a matter of working with them on implementing those new habits over and over and over again until they take on these new skills and get them on with a life of purpose. That's where I think we ultimately make a difference. And that's why most clients we engage for at least 1 year, because that's going to take time. Some of it is in that stabilization phase. Sometimes it's issues of people coming out of psychosis takes them a while. Other times it's also stabilizing them mentally because of other mental health issues. And so that stabilization process can vary in how long that takes. But we need to stabilize them first before we help educate them, some on what led to this, but also on what is a new way to live. And then it's about implementing these processes over and over and over again. And clients are either going back to school, back to work, or some are retired or doing other service work while in our program. And how do you implement all these skills in those different settings? And ultimately getting them focused on a life of purpose that they're passionate about. As you mentioned earlier, I sit on the Overdose Fatality Review Board for MAPForce. It is very helpful to be able to take a look at the toxicology reports, but I think what's more important is all the family interviews and the interviews that are done with other supportive people in their life to get more understanding of who was this as an individual and not just as a report. Who were the people in their lives? What issues did they face? Mental health issues, substance abuse issues? Was there issues of trauma? Did they have access to help? Did they take advantage of it? Did they reject it? We get a more complete picture of this life, unfortunately, that was tragically lost. So we can go out there and do things of education, which is part of what I do and some of the other people that I know on this call, is to go get the message out there, make individuals aware, and also make them aware of the help that really is available to them. And so those are some of the things that we do from a prevention standpoint.
Thank you so much. Next, let's hear from Stacy Cope.
Hi, good morning. My name is Stacy. I'm with Sonoran Prevention Works. We are a statewide nonprofit, though we do have some staff in Yavapai County. And our approach to overdose prevention is multi-layered. So definitely the micro on the ground, doing street outreach, handing out supplies, building connections, training people on Narcan or naloxone, and really just like building those relationships with people who are using drugs. And then certainly we do more like professional trainings with recovery homes, with hospitals, with all the different sectors, to provide more information, education on how to support people who use drugs, how to prevent overdoses, what are the major risk factors for opioid overdose specifically, and what kind of conversations can we have with folks. And then definitely at the macro or systemic level, working on policy, advocacy, laws that make it really hard for people to be safe and to stay connected to their communities. So yeah, it takes all kinds, right? And lots of different approaches. And our desire or goal is really just that connection, and providing people with the tools and resources that they don't get anywhere else. So if I go to treatment for a year, if I go to the hospital because I just overdosed, if I spend time in jail, when I'm leaving those places, typically they're not talking to me about overdose prevention. They're not providing me Narcan. They're not coming up with a safety plan. They're just telling me to never use drugs again, right? Cross our fingers, just don't use drugs and you'll be fine. But that's not the reality, right? That's not the reality of most people's lives. And we know that substance use disorder means people will re-engage in use many times. Some people will never stop using drugs. And that does not mean that they deserve to die, be isolated, or removed from community. Yeah, so we need each other to do this work. And yeah, I'm grateful to be a part of the conversation. Thanks
All
for having
right,
me.
thank you so much. Paula.
Hey, so at North Country Healthcare, we serve pretty much the entire northern part of Arizona. We have facilities all the way to California, Nevada, Arizona border, all the way over to New Mexico, way up to the Grand Canyon. And we are an integrated FAQH facility. So we do mental health, we do primary care, we have an outreach program, we have OB, we have dental. It's really a whole body and mind facility. When North Country got started, the whole purpose of it was to serve communities that were underserved and making sure there's access to care. Unfortunately, now with technology, it's a little bit easier too, because there are some areas to where our patients are unable to get to our facilities. So we're able to do telemed. And fortunately, even before COVID, that was a possibility with them. But my team in particular, we are very much hands on. We're boots on the ground. We're reaching out to different facilities and at different events, whether it's behavioral health facilities, whether it's treatment centers, local community events. We're very involved with the different resources in our various locations as well. I know in particular in the Lakeside area, we have what's called the Re-Center, which is it's associated with the local church called the Church, and they're about helping the homeless and kind of the same morals. And they also do statewide help as well, as long as people can reach out to them, and they have a really good program. There's a mamas and a re-entry program that I'm associated with, and it's a mentorship to help individuals, meeting them where they are, giving them the skill set of being homeless and not having that skill set of how to thrive in life, and really just sitting with them along the way. And there's different classes. Anyone can go. You don't need insurance. It's completely free. And so just really trying to partner with them and other places within our state to try to help educate. A lot of times it's generational. And so just trying to show people that there's another way of dealing with things is obviously the goal is abstinence, but if that's not the case, and we're just meeting them along the way. So we also do provide Narcan as well. I'm on various committees with the different counties. Since we are so large, we actually even help serve all the way into Las Vegas, and just trying to make that impact of letting people know there's help out there, even though they may not realize in these smaller communities.
Thank you, Paula. And next we'll go to Lou.
Hi, everybody. Thanks for the invitation to be a part of your group. I'm with Cochise Harm Reduction, and we are based out of Bisbee, Arizona. So Cochise County. I don't even think I've actually been to Yavapai County, so I'm glad to learn about what's going on up there. But I do think there's overlap between our two counties, as I do believe Yavapai is largely rural county, as is Cochise. So we operate a mobile harm reduction outreach program in Cochise County. And so we have a van that drives around the county on regular delivery routes and visits people where they're at. People who live in encampments, people who are living in houses, people who are living in the desert. We see our populations that we serve are people who are using drugs or people who are unhoused. And so we address overdose prevention in our community a number of ways. I mean, our organization, as my bio said, was really built out of addressing preventable overdoses in our community here in Bisbee. And so we do naloxone distribution. We run a syringe access and disposal program. But, you know, and that's really how we started. But as we got going, we realized that we were really built out of the lack of services and all of the barriers to services which exist in rural communities. So that is why we have a mobile program. And so we've ended up kind of filling in the needs for a lot of different kinds of services. So we run a Meals on Wheels program. We distribute hygiene and wound care supplies. We distribute camping supplies to people who are unhoused. We run a mobile food pantry. All of our staff are trained in peer support, harm reduction education, naloxone administration. And so really our efforts are to educate people because we do have a medication that can stop an opiate overdose. And so our goal is really to get that into the hands of everybody. When you live in a rural community and you call emergency medical services, it's most likely that they are not going to get there in time to respond to an overdose. So it's really important that people who are using drugs know how to respond to an overdose. I believe the statistic is like 70% of the time, it's people who are using with that individual who revive that individual from an overdose. So that's really our main, getting Narcan and naloxone in people's hands and educating on how to use it is our main goal. But we also work with stigma. Something we regularly say is that it's not necessarily the drugs that are causing the overdose, it's stigma, because people are often using alone when they overdose, or people have that shame. And so a lot of our work is just based around relationship and community and providing that regular, for someone to get that regular visit, where they know our staff is going to be there, the van's going to be there, they're going to have someone to talk to, they're going to be able to get supplies and a meal today. It's so simple, but it really goes a long way. And so our organization is entirely comprised of people who either have living experience of drug use or lived experience. And so we work to create a lot of low threshold, low barrier employment opportunities for people who are using drugs. And I do believe that that's the place where we have the capacity to have the most impact on people, because when you give someone purpose, it's giving someone so much more than a meal or naloxone, all these things that, are life-giving, but purpose sustains. And so our organization is really built in a way where we're just trying to build community, because I do think that community is the cure for a lot of these societal problems.
Excellent. Thank you. Thank you so much. We don't have, you're the only one from the South, and because you are a rural community, there is a lot of connection. And so I appreciate you being here on this panel. Next, we'll go to James.
Hey, good morning. Thank you. Can you guys hear me okay?
Yes.
Got a new setup here in my office, so don't have all the bugs worked out yet. I was going to say tough act to follow, but that was 4 tough acts to follow there. But thank you for the invite, Lori, and glad to be here. So my name is James Tobin. I work for Yavapai County Community Health Services. And prior to that, I worked at Yavapai College and I was a police officer. And ever since my police academy days, 1996, I just have had a passion for alcohol and drug related issues and how they affect quality of life in a community and what we can do about it. And so I worked the enforcement side of it for a long time in my career. And then I got involved in the prevention side of it through working with MatForce and other coalitions and stuff that we have here in Yavapai County. And of course, the education part of it. So I've done enforcement. I also was a DARE instructor for 2 years. If you guys remember the DARE program, I know there's a lot of back and forth about, whether it's effective or not effective. I have my own opinions about that. I think it was time well spent. Unfortunately, though, the program went away due to budget cuts during the recession in 2008, 2010. So my position that I have here at the County Health Department is a new position that was created last summer using opioid litigation funds. And so we have a new section called substance abuse and mental health programming. So it's a combination of those things. Today, for example, we're hosting Cares First is putting on a train the trainer for mental health first aid, because we know these things are co-occurring and they have overlapping areas of concern. And it seems like it seems like there was a time we had mental health first aid classes offered all the time. It was almost oversaturated, it seemed like. And I think during COVID, a lot of the instructors lost their certification because they have to do a certain number of trainings per year. So we're trying to get that back up and going again here. And we've got 16 people in the class today, 2 from Cochise, actually only 4 from Yavapai County, and the rest are from Coconino, Cochise, and Maricopa. So a couple things that I'm involved with, using these, I manage and oversee these opioid litigation funds. Every county has them. They go through the Board of Supervisors, the county supervisors, and then through the health department. And so I'm really keen on trying to make sure that we turn this money back into the community in a positive, productive way. So for example, we have 12 grants right now that are out there totaling over $500,000 for various agencies and organizations within the county people are just doing, good prevention work. So we're really happy about that. Got Doug mentioned the Overdose Fatality Review Board. We started that up here in Yavapai in 2015, and we have a large group, very active group. And we've actually started this year having subgroups where we actually kind of pick the cases and then come up with some recommendations, and then we present to the bigger group every other month to get everybody's input on that. So last year in Yavapai County, we had 66 overdoses, 70% involving fentanyl. The last numbers I saw, and Doug, correct me if you know something different, was that in May, by the first week of May, which a couple months ago, 3 months ago, we were on pace for about 70 overdoses this year. So we're hoping our trend line has been going down slowly, hoping to see that continue to go down, but I guess we still got some work to do there. We opened up a connection center outside the Yavapai County Jail, which is really cool. It's for people coming out of incarceration, whether they've been in there 6 hours or 6 months. They can come through our center. We connect them with resources, whether it's food, housing, employment. Transportation is a huge one for us. Or food insecurity or substance abuse, mental health. We used opioid funds. We created a peer navigator position, somebody with lived experience who started in July, who can help folks coming out of detention, clients coming out of the jail with those specific needs, who can kind of guide them into the recovery community with, a warm handoff or a warmer handoff to organizations like Hope Inc. and other organizations that are doing that kind of work. So that's really cool. We're starting a ride program using some of these opioid funds for people. Like I said, transportation is a big issue. And so they come out of jail and they have no way to get back to Congress or Seligman or Ash Fork or Black Canyon City. And we are just scrambling to try to figure out how to get these people's rides. So we're using some of these opioid funds when people meet the criteria, where we can give them a ride, and not just a ride home, but if they need a ride to their next court appointment, mental health screening, AA meeting, NA meeting, we'll give them a certain number of rides to help them out there, not become their permanent source of transportation, but bridge that gap, help them bridge that gap a little bit. And then we're also starting a Narcan leave behind program. I think Stacy mentioned, and Lou also, getting Narcan out into the hands of people. Through my years in law enforcement and stuff, and since Narcan's come online, fact of the matter is we throw a lot of that stuff out because it expires, because it sits in closets and Connex boxes. And our thought is, let's get that out into the hands of the people that could use it. So I went out and with my law enforcement contacts, I've got buy-in from all the agencies so that when the officers are on scene, maybe, they all carry Narcan in their pocket and they deploy it if they need to on scene to save a life. But what about the people where nobody's in crisis right at that time, but maybe it's an environment where they could benefit from having some Narcan in the house? We're creating these leave behind kits for law enforcement to leave behind with people in those situations. And, you know, I try to encourage them, don't just think about somebody you might just think as a, you know, habitual drug user or somebody who's involved in a drug lifestyle. What about when you go to a senior's house and they have 40 meds, 40 different kind of prescription meds on their counter, you know, and they can easily lose track of what they're taking and stuff like that. So it'd be good for them to have Narcan on hand too. It's a miracle drug. It's an over-the-counter life-saving drug. And so we're trying to get as much as we can out into the hands of people in the community who can use it. So, and the last thing I'll finish up with, through my work with, I'm sure you guys are all involved with different coalitions. And I would say in my career, being involved with our coalition up here, MatForce, has been my favorite thing that I've been involved with in my career, because it's grassroots problem solving. Yeah, law enforcement, you know, should have a seat at that table, but we don't need to run the table. When you work collaboratively with other people coming from all these different angles, working on the same problem, man, it's just a force multiplier, you know, but we got to get our egos out of the way, and everybody has to work together and work cooperatively. And it's really exciting when you start to see progress. So, I would encourage you guys to keep going if you're, you know, sometimes it seems like we're spinning our wheels, but what I really love about MatForce is it's an action-oriented coalition. I've seen some of these coalitions and groups around the state sometimes where they get bogged down and they think the meetings are the purpose of the coalition. With MatForce, you know, you have to have meetings to network and stuff like that, but you plan strategies, right? And you do programming. And then you got to be honest with yourself about what worked and what didn't work, because we don't have unlimited funds. We got to get bang for our buck. So you got to be honest about what's working and what's not working, and double down on the stuff that works, and the stuff that doesn't work, chalk it up, learn what you can from it, and go like hell in the other direction. So thank you for the invite. Appreciate it.
All right. Thank you.
It's interesting. I've heard some excellent presentations and learned a lot. What I find missing is what James really addressed, and that was people working together. I heard different agencies and outreach and creative ways that you're expanding and outreaching other resources. And so my concern is, you know, and I would like you guys to address is, what other agencies or groups are you working with? And especially, I have heard nothing about family support, and that's an integral part of healing. And so I would just like you guys to address, you know, are you working with other agencies like Polaris, Spectrum, FIC? The only one time I heard a reference to Hope. And so if you could share that, I'd appreciate it.
Yeah, I would love to jump in on that if you don't mind. So, you know, my primary outreach with other organizations, I did it before when I joined Mayor Oberg's committee. So Mayor Oberg was the mayor of Prescott back in July of 2016 until Mayor Mangarelli was voted in January of 2018. And we had a mess of a situation here in Prescott as far as what were so-called structured sober living homes, but they really weren't. And so my partner sat with Noel Campbell, our representative at the state level, to get a bill passed for greater oversight of structured sober living homes, because we really didn't have any at that time. And then I sat on Mayor Oberg's committee from July of 2016 to January of 2018. When I came on the committee, it was loosely estimated we had about 250 sober living homes in Prescott, which is a high saturation. They weren't well managed, and the community was really upset. And so it was working collectively. There was 8 of us that sat on that committee, from law enforcement to people who were in local government, some other concerned citizens who were also business owners and things of that nature. What I didn't really find much of the cooperation from, I hate to say it, was my peers in the industry. I actually had peers that were upset with me that I sat on the committee that we were trying to gain oversight because they kept saying there wasn't a problem, which obviously wasn't true. What I really heard from them is, I don't want oversight. And so some of it was in that work, but some of my other is these different committees I sit on. That's part of the reason why I sit on them. Like James, has mentioned, I mentioned MapForce. So there's a number of different organizations that we work with, Polera being one of them, Spectrum being another one of them, on how do we work cooperatively together to get help to the individuals that may not be right for one organization or another, or how do we collectively learn together so we can provide greater services for our clients. So MapForce is one of them. One of the other things that we didn't mention earlier was their reentry program. The reentry program is awesome for helping individuals coming out of jail, coming out of prison. And, as was mentioned earlier, if you just release them out there without a plan, you're setting them up to fail. And so there's different agencies and organizations. It is a coalition that's working together to make sure that they have a reentry coach that's helping them anywhere from helping them find places to live, jobs, transportation, so we can hopefully set them onto a better path and not just leave them out there to try to figure it out on their own. And then on the different committees that I sit on with MapForce, there's people from the court system, from law enforcement, from other agencies, whether structured sober living homes like the Oxford House, or whether from other agencies, Catholic Social Services, to Spectrum, to Polera, as I mentioned earlier, the County Health Department. Leslie Horton, who's the director of that, sits on that as well. And so there is a lot of really good interaction from a number of different agencies and individuals that are.
Doug, let me interrupt you, because I sat on the opioid review for 3-4 years. And there was not the involvement of the behavioral health community for a long time, especially looking at the root cause analysis. That piece really wasn't part of it very much. I mean, that has changed. So what I'm concerned about, it seems like the same players referring back and forth. My concern is, and you're answering it, and it's wonderful for those involved, but how many other agencies are involved in some of this? How many agencies are encouraged to be, specialty providers? And then where is the family voice? Because that's not included in this. So, and I appreciate your response. It's just that I think it's very limited for just certain groups of providers.
Well, let me ask you this. So two things really quickly. So on the family front, the family is involved with the interviews when it comes, unfortunately, to the overdose fatalities. That's who we're reaching out to. That's who we're also asking, is there support that we can get you? Are there children that were involved? How do we get help for those children?
Well, where are you referring them to?
Well, it would be different agencies depending. Unfortunately, here in Yavapai County, our options are really limited. That's part of the problem.
And
right?
And I think that's where I just want to challenge people in thinking that I think that part of the problem has been that we've limited ourselves because we have not encouraged historically as a county, to develop these other providers to exist, because we didn't refer out. There was no referrals. So now we have agencies like FIC, Hope, and I'm referring to the peer and the family runs because I'm most familiar with them. But they're really having challenges, and yet they're available. And I see some of the agencies here that have problems. They can't handle their caseload. But where are they referring out? Are we doing single case agreements? So it's just a challenge to all you guys to address that.
Yeah.
I'd like to hit on that family topic. So in Navajo and Apache County, we have a couple treatment centers that I worked with on consulting. And one thing that we did incorporate, and maybe other facilities are doing this as well, but with these live-in facilities, before they are transitioned and discharged to either go to sober living, return back to home, or whatever the case may be, one thing that we have stressed in putting our SOPs out there is bringing the family in and educating them on different triggers, on different issues that they had. And it's normally a month process. Like facility, it's really cool. It kind of has cabins. I mean, we're up in the mountains and everything, so they're able to kind of go out and kind of see what that day-to-day life could kind of be like, and prepare that individual that is being discharged, because you do see a high number of relapses when people are released from treatment centers because they're not quite sure how to deal with it when you're finally face to face. So that's something I do know, at least up here, that a lot of treatment centers have incorporated, is making sure that there is a warm handoff. And after the family has left, okay, now let's sit down, let's do a hot wash, let's take a look and see, okay, what triggered you? How can we approach it? How can we support you? And then also they do a handoff for outpatient. No matter where they are, they follow up on these individuals that have been discharged, and just making sure they're feeling supported and building that community too. So I just wanted to share that part of it, that hopefully that gives some people something to kind of go off of.
Thank you, Paula. And I know the recenter, if every community had what the recenter is and does, we'd all be better off. Because that's a real hub. We did a forum up there for behavioral health, and it was amazing. So one of the things that I heard mentioned was generational, how the use can be generational, and connecting with folks. Education is an important piece. And as we look at outreach and education, who's working with the youth? Are you getting into the schools? Are the schools resistant? What's going on?
As far as MapForce is reaching into the schools. Some of that is with education, going out and doing speaking at the schools. I've done that in a number of schools. There's also a peer-led education process. So as an example, Lincoln, which is one of our local schools here, I supervised 2 high school students. One was a sophomore, one was a senior, to do a presentation to a first grade class. And part of what the presentation was to take 2 baskets, because you're dealing with a younger population. You don't want to go straight at fentanyl with it. And one basket is for healthy items, one basket is for unhealthy items. And they just talked about different things in the house, how to help them be problem solvers and discern what kinds of things might they find in the house that's healthy, what might be unhealthy things that they might find. And it's amazing to watch the younger kids look up to these high schoolers like idols, and they really get their attention. But it's also amazing to watch the high schoolers, like what kind of excitement that they get in order to be able to give back and educate the younger population, and also picturing how that can be a positive ripple effect amongst their peers in high school. So I find that really helpful.
Yeah, we're also, oh, go ahead, James. Okay.
Also, go ahead.
So we are also going inside different schools. We do have some resistance with some religious backgrounds up in our area, where they want to do the education, the parents do. So we do run into that barrier a lot of times. We try doing town halls and letting them know that, you know, we're not encouraging use, because that's a big thing. For some reason, there's this thought process that we're encouraging use, and we're not. But I think that's one of the barriers we have been facing, is parents are saying they want to be involved, but yet, I mean, Navajo County and Apache County are one of the highest rates in the state. So, and then also trying to reach out to our different tribes that are up here. We are closely located to Navajo Nation and the White Mountain Apache tribe, and trying to get into those, and just seeing, I mean, a third world country pretty much in these areas, to where they don't even have water. And so just trying to be able to be a resource and educate those groups by getting our foot in the door. Fortunately, we do have some advocates that work with us that are part of those communities. So that's been kind of a help to be able to get our foot in the door. So definitely reaching out and Something I've heard recently, I just came back from Washington, D.C. for a HIV conference. And one of the things I sat in on a listening group, and they were talking about just the stigma. Well, they don't look like me. They don't understand me. And I mean, unfortunately, that's what we're facing out there is people have been hurt by other people and just trying to break through those walls and trying to share that stigma that we're seeing. So.
Anybody else on the panel want to comment on this?
I was just gonna back up what Doug said. Matt Force up here has a really robust curriculum with a good relationship in pretty much all the schools throughout Yavapai County. There's occasionally some pushback from schools about certain subject matter and things like that, but we kind of navigate through that. And the peer-led programs that Doug mentioned, and we even Yavapai College student athletes also get involved in this also. I've gone into schools with those young people, and they just have so much more credibility with the kids. You know, they really want to hear what these, you know, slightly older peers have to say. Whereas when it's an old guy like me or Doug, it's maybe a different conversation.
Mm-hmm.
So I don't know if you guys have experienced this, you know, and then there's community events and outreach events, and it's getting harder and harder to engage people. You know, in the traditional, let's, you know, have a presentation at a room at the college or some public meeting place. And, you know, it used to be you'd get 25, 30, 50 people would show up just out of a curiosity factor to learn about something, you know, that might affect them. And it's like pulling teeth to get people to come to things anymore after COVID. Maybe, I don't know if you guys have also experienced that. So we got to find different ways, you know, to get the messaging out there. And it's just maybe people just have too many options now, and you know, things are going too fast. But I just wanted to also mention in my outreach with the police officers, there's that stigma thing, right? Where I know there's some police officers sitting there thinking, because I've been there, hey, if these people want to do drugs, let them do drugs. And why should we try to save them? Or why should we, you know, let them suffer the consequences of their own bad decisions? And I can talk to them about how I can understand and appreciate that point of view. Got to move past that. These are human beings. These are people that, you know, not everybody's just going to continue to use and relapse after relapse. Some people will stop and get clean and get their lives back and become productive members of society. And, you know, I can give examples too of people that have been saved by Narcan or saved by an intervention who have gone on, you know, to really lead a productive life and productive or making, you know, good contributions in the community.
Thank you. I want to come back.
Sorry. I just wanted to mention, I put in the chat that there are two events coming up. One is this next week, August 28th and 29th at Twin Arrows. The Navajo Tribal Summit is going to be held, and it's free. And they also, if you're interested, you can also have a table there to pass out your resources. And then the Hopi Behavioral Health Agency is having a resource for 12th. And again, it's free and you can have a table there. So all of the people that are represented here, this would be a great opportunity for them to collaborate, maybe reach out and maybe connect that way.
Thank you, Sherry. And I know that I've sent flyers out for some of these events.
Right.
And this ties into what Kathy was saying about How is everybody collaborating with everybody? Is everyone being connected with, is the outreach a small collective, the same, contacting the same organizations? Or are you looking at who is out there that hasn't been contacted yet? And I know that we have coming up in Yavapai County in Prescott, September 28th, two events on the same day connected, Prescott Walks and a recovery celebration. So I don't know exactly who the organizers are, but I think it's important to contact all the residential, providers, the behavioral health providers, the youth, the peer and family run organizations, invite them to have a table at these events. Oftentimes we find there are providers that didn't know each other and how they complement each other. And they meet at these events and find out, oh, you're doing this, we're doing some of the same, but you're doing this that we're not doing, and we're doing whatever that you're not doing. And it's a great connection. It's not about competition. It's about, statistically, 5 people or more die in the United States from an overdose of fentanyl. And we're here to talk about prevention, and I'm hearing some really great things. And you guys that are on the panel, you're all doing fantastic things. But I think that getting the word out, and this is something that I think Lou said, it might have been Lou, getting the word out. You've got an outreach van, but how do you get the word out? How do you reach? How are you all reaching not the unreachable, because we got to reach them, but I know there's a challenge there, but what's being done in that respect too?
I can jump in here with a few ideas. We don't serve youth specifically, so I just don't have anything to add to that conversation. But in terms of outreaching and, just some comments on your question, Kathy, about collaboration, when you live in a rural county, there's not that many services, right? And oftentimes, even if you don't fully agree with other organizations or agencies or people, we all sit at the same table. We're neighbors, sometimes we're family. We have to get along. And I think that that's part of the beauty of working in a rural area, and especially Cochise County. I think that and really, I attribute that to CHR's success in a lot of ways, that we are even though not everyone will agree with harm reduction, because some people see it as controversial, we're always invited to have a seat at the table. And that is because most people, we are the organization that is reaching people who use drugs. We refer out, of course, for other services, but oftentimes when we're sitting at that table, we are the liaison and the advocates for people who use drugs, people who weren't otherwise accessing services. The majority of our participants don't actually access any other services. And so how do you reach people? And I think this goes back to some of the stigma stuff that was talked about earlier. A lot of the people who work at our organization are people who are currently using drugs. They are still productive members of our society. They are humans. They are doing wonderful work. And so people who use drugs will often band together for a lot of reasons to avoid stigma. In a rural area, it may have to do with maintaining your dose and not getting sick. And so once you have an into that community, which is quite insular for good reason, you will reach all of these people. And so I wonder if there's really organizations on the ground in Yavapai, probably yours, Paula, I'm not sure about anyone else, who's really reaching people, because once you have that and you have the trust of that community, people will flock to you. And that's what we've seen. We've had a massive demand for our services, which just really aren't offered by any other organizations in the county. We're a rural area and we just don't have that many services. So what we started to offer when we started working and offering services to people, it was quite profound, because nothing like that had existed here before. And so all of our marketing, we use lighters. It's our business card. And so we have our hotline printed on that lighter, and we have more requests for services than we can handle. And so I think a lot of it goes back to just how we're treating people, that unconscious bias and stigma that's really written into our language and our our affect, people don't want to interact with that. It's not what people want to interact with, and they're going to interact with services that makes them feel like a human and a whole human being.
Lou, this is James. Did you get a lot of that mobile unit that you talked about?
Yeah.
Did you get a lot of pushback on that from, I could see a lot of stigma happening from cities and towns saying, yeah, that's fine, take that to the next town over there, they need it, but we don't need it here. Or is there any kind of issues with that?
You know, when I first started the program, I really expected so much more of that. And that's kind of what I speak to when I say, like, I think the beauty of living in a rural community is that we just all have to work together. We have the support of a number of city administrations in Cochise County. We have support from a number of law enforcement. Like, we actually have a ton of community support. And I think a big reason for that is because the people that we serve historically have not accessed services. And so we're really able to enlighten the service community and the other stakeholders around what the needs are of these populations and why they weren't accessing other services. So we've actually had, like, it has been rocky. There's certain communities in Cochise County that are much more supportive of us. I'm grateful that our home base is in Bisbee, because the city of Bisbee is an incredible partner of ours, been super supportive. So is the Cochise County Health Department, which is also located in Bisbee. There's certain communities that have been not as supportive, but we've been able to have dialogue with almost all of the city administrations in the county. And it's actually been a way less rocky road than I was envisioning.
So I understand, James, that we did have a mobile unit, and there is challenges. Was that because of stigma, or what's happened with the unit?
So I'm not aware. Based on what Lou described, I've seen and read about that in other counties and other parts of the country. I'm not aware that we had something like that specifically related to substance use in Yavapai County. Now we are about to the county health department's about to launch some mobile health clinics to get out to the rural. They just got the funding and they got the vehicles outfitted, getting everybody trained to drive the thing, and so we can go out to these rural communities and set up and I think they can do dental work in there and all that kind of stuff like that. So I'm just wondering if that we can have a role in that too, where we kind of sneak it in there as a service that's offered, not be the sole reason why these vans are going around, but a component of the services that they offer. I think we can do that.
So I would like to ask Anthony, put you on the spot. Did we not have a mobile unit that Care First help implement? Anthony? He's gonna hide now.
It's gonna take him a minute to unmute.
Yeah, thank you. It took me a minute. Good timing, Kathy. I just got down to the valley too, so the phone won't cut out. We were working with Spectrum, and we had like James was saying, it was solely for medically assisted treatment for opioid use, and that was going on since I believe October 2023. And right now, I believe Spectrum is still operating the vehicle. I can say, I believe the encounters have been below our expectations throughout Yavapai County. It's something that is top of mind for us and something that we continue to work on. But right now, that's currently the status of it. There is a vehicle to serve Yavapai County and some other regions where needed. I've actually connected some of the folks at Denorm Prevention Works with the folks at Spectrum to try to be able to go out and serve some of the needs over on Hopi lands as well. But yeah, it's a work in progress, and we're currently working on refining the work that vehicle is doing throughout the county and some of the surrounding areas.
Well, I want to put the squeeze on you, Anthony, because I think it's very much needed. And let's get it up and going and get referrals going.
We absolutely agree too, Kathy. It's just one of those things that's gonna kind of take us a little while to keep getting our footing with it, and also working with our partner agencies and Tobin over at the Connection Center and a lot of other folks in the county too. So, what more good will continue to come as we keep refining our practices and refining the approach.
Thank you. So I want to invite Stacy with Sonoran Prevention Works to maybe share something. How can we the other organizations learn from you? Because your organization has done such a great job statewide getting Narcan out there. And how did you figure out where to go, and maybe there's something in your recipe that can help others?
Yeah, thanks. I mean, just want to boost what Lou was saying. When you provide services that people actually want and need and treat them well, you don't need to worry about outreach and promotion. They will come to you. And that word of mouth is so powerful and important. And that's for all of your staff, right? Not just your staff that work with people with substance use disorders. It's the first person that people see when they walk in the door. It's whoever answers the phone when they call. Like, every staff member needs to feel confident and competent in how to treat people well, which may, you might think, oh, all my staff are so great and so lovely. But these, little ways that people send messages to the folks that we're serving that like they don't belong there, they are bad, broken, dirty, whatever the words, they pick up on that, right? They know that and they feel that. So I think first, just providing really good services and being really good to the people that you serve. And really, it just took time and persistence and maybe some like naive or stubbornness. No matter how many like doors get closed in our faces, we just keep moving and keep going, and know that we're like doing this work because we care about people who use drugs and we want them to be alive and connected. And I think it was kind of like, at first we were trying so hard to like get everyone on board, get all the behavioral health and treatment and medical services like on board with us, instead of just like focusing on the community that we serve. And once those organizations see that all the people are coming to you, and they're not getting the grants anymore and they're not getting the participants anymore, then slowly people start to come around. So that's one way, just doing the good work. And making it as accessible as possible, making it as low barrier as possible, right? People don't have to jump through hoops. They don't have to fill out a million forms. They don't have to give us personal information. They don't have to do all of this work to prove that they deserve Narcan or deserve a meal or deserve a hygiene kit. They deserve it because they're human beings. And then I think our strategy, more so the last 2 years than the previous years, was we noticed that we would come to organizations, do a training, or an organization would come to us, we would do a training on overdose prevention, Narcan, harm reduction, and we would come do that 2-hour training, and then we would never hear from them again. And it just kind of was, that's it, right? Nothing was actually implemented into policy. Nothing actually changed with their programming. So really trying to like push for train the trainer. So if you want the information from us, first you need to tell us like how you're going to continue this work, right? You're just going to get the information and carry on with your day and nobody actually utilizes it. That's a waste of everyone's time, right? But like, how are you actually going to put it into your programming? How are you going to shift? If you're saying we need this education because something's not working, right? Our clients keep dying, or nobody's coming, or whatever it may be, right? Whatever the particular problem that you've addressed, maybe somebody passed away in your residential program. And so then everyone's freaking out and they think, if I just take this Narcan training, then people won't die in my facility anymore. But that's not how it works, right? It has to actually be a part of your policies. Your staff have to be mandated to treat people well. They have to give people Narcan, not just because maybe they want to or they agree with the philosophy. And so like what needs to happen in order for that to occur, right? Like, do you need more training? Do you need a template for policies and procedures? Do you need us to come to your facility and show you how it all works? Great, that's what we're here to do. And we get lots of money from the state to do this work. So utilize it, right? But kind of my soapbox here is just education without like action, education without change, without policy change. Where is that getting us? Not very far, right? We might have some new words to use, but if it doesn't actually impact people's real lives, then it's, yeah, not a great use of our time.
Thank you. Yeah, and I'm grateful. Several years back, one of the organizations I've worked for attended one of your trainings. And I think that, you know, you've got to know how to use the tools. You can't just put them out there. You've got to have people trained. So I have a question for the panel, and it's multifactored. There isn't one magic approach. There isn't one magic thing to help prevent an overdose. But in your organizations, what do you feel is needed to help you succeed in accelerating prevention? Or what combination? I mean, what would you say to that? Kathy, help me out if I'm not asking the question.
Well, I absolutely loved what James shared. And that's, giving these tests to the police officers and, just handing them out to the community. What could be a better way and infiltrate? And that is so great. I just, because I always have those Narcans with me, and I've tried to give them like I tried to give them to the volunteer firefighters, wilderness firefighters, and they said, well, our firefighters don't use, so we're not going to take them because it doesn't happen. And so anyway, I love that creativity.
We've actually seen some of that pushback. Actually, Leslie Horton, who is also on the board of directors at MapForce, was talking about at a recent meeting how she went out from the health department to hand out free Narcan to different sober living homes, and some sober living homes rejected it because they said, we don't have a problem. And I'm like, how is that even possible? Right. But unfortunately, that's some of the mentality.
OD, that's why.
Yeah, that's well, and I also saw, one of the questions earlier about some of the pushback. Unfortunately, some of the pushback I've seen while speaking at a school, I brought up ACE assessments and the impacts that adverse childhood experiences have on people later in life relative to mental health, substance abuse, physical health issues. And after doing the presentation at the school, the director pulled me aside and said, I loved what you said about ACEs. We actually did ACE assessments, she said, a couple of years earlier on our students, and we found that a high percentage, over 80% of our students had multiple ACEs. I said, okay, what did you do about it? She said, we stopped doing the ACE assessment because we didn't want to highlight that there was a problem and then become responsible for it. And my head almost exploded. Like that doesn't solve the problem.
But it did.
Oh yeah, willful blindness will get people killed. Right? People will die from willful blindness. And so, the question inside an organization, it's multiple things. It really is treating the individual holistically. And that's why I mentioned we work with them mentally, emotionally, physically, spiritually, socially, working on focusing them on that sense of purpose, show them they have worth. Get them to step into who they can be as an individual and see that as their identity and not who everybody else has said their identity has been. And give them that healthy self-confidence. And it does take the family involvement. We will not work with clients if the families will not cooperate on that, because it's almost like sending somebody away potentially, let's say to a student to a really good school, and then they go home to a traumatic environment. You're going to undo everything that's been worked on. So it is about educating the family. And unfortunately, sometimes the families don't want to be involved. They'll say, we don't have the problem, they have the problem. And the families don't understand the dynamics of how they've changed, how they've been involved, how they've been impacted, and they need help. But some get involved, some don't get involved. And then it's also a matter of, I do not believe we are the end all be all for everybody. And so when individuals have other needs that our agency doesn't serve, either I'm referring them there or I'm cooperating and coordinating care for whatever those specialties may be that we don't provide. Because if you leave those gaps, that's where potentially it's almost like, to me, it's almost like cancerous tumors that you don't go after and hope that they don't metastasize back and take back over the individual. And so it does take the cooperation of other agencies that have specialties in different areas that we may not have, or don't just take everybody. You know, one of the things that I said when I was on Mayor Oberg's committee, when they were interviewing me to see if I was appropriate for the structure oversight of the structured sober living homes, is they said, what's your exit policy? And I said, well, the really good exit policy starts with a really good entrance policy. How much have you really taken the time to build the connection, hopefully build some bond, build some trust, to see what kind of help does this individual need? And unfortunately, I have peers in my industry who will take anybody who will pay them. And they really aren't appropriate for handling the care of these individuals. And they also do, by the way, isolate, to Kathy's point, where they aren't going to reach out or refer out because they want to try to collect as much cash as possible off the client and not lose that client. And so I appreciate the different people who are saying, I want to get involved, and that step in and offer services. There's different perspectives, and yet there's a lot of common things that have been said here. And so I love what I'm hearing from the other people on the panel here. And different clients are going to have different needs. They're going to have different perceptions, different beliefs, different aspects. It's like, God bless, let's get them the thing that's going to help them. Let's give them the thing that's going to allow them to tap into the dignity of who they are as a human being and what's their possibility in having a purpose in life. So I love all these different aspects.
Again, I think especially in rural areas, and this is one of the reasons that the Northern Arizona Peer and Family Coalition got going so strongly up here, was the idea of choice. And we found that the referrals were not being, they were being held in the health home. There wasn't the competition. And I think that culture is still here. And we need to break that. And because one of the biggest barriers is not only for autism, for the depopulation, because we don't have the resources, but it's also for family support. And, you know, that has to change. So there.
With some of that support, and unfortunately it's limited, it's another committee that I sit on for YRMC, so for our local hospital. It's the Family Resource Center. And so we take a look at families in crisis, typically with kids in the age range of mom's pregnant to 5-year-olds, and they can have older siblings there. But we're looking for, how do we provide services when they're in crisis? And that can be because of mental health issues, because of substance abuse issues, because of financial stressors, because of maybe not being able to meet some of the other needs. And some of it is education, some of it is through services that the hospital offers, but we're also looking for what are those other outside resources of where we can refer people to. And so that way that the families can get some help and try to resolve those issues there so kids aren't plucked out of the family.
We have those resources and they're not utilized. That's my point.
Okay.
Those resources are, and one of them is FIC, Lillian Armstrong. I don't know if she wants to speak to it, but there are several family runs, just like a peer run, that are here, that are available. And
So
they're not
but here's what I would ask as a favor then. I would love to take it to the director of the FRC.
You've got it.
Maybe it's just simply we're unaware. And I would rather
But that's what's so sad. I agree with you, Doug. that's what's so sad when we've been pushing and pushing and pushing. And
Yep.
it's not just this, it's choice in this community for the DD population, all, everyone.
But if you could, Kathy, if you could
I
please
will.
send me a list of those resources, I can guarantee you the director will have it.
Okay.
And we'll work on and getting connected with people.
I have a question. When everyone's doing referrals, is it just a paper that's being handed off, or here's a phone number, call them, or is there a warm handoff that's occurring? Because I find that so much different, especially I oversee the Ryan White program, North Country, and it's HIV, and it's very sensitive, right? And some people, I'm the only person that knows their status, and once you give that warm handoff, it's a whole different ball game. There's a person
You're
of
right.
trust.
You're absolutely right. But what happens is a lot of times people go to these specialty providers, but they have to have that referral eventually. They're allowed so many times from the health home, and the health home will say, no, we provide that here. Or they won't for whatever reason. And this is statewide that we've run into this, but it's really pronounced up here. We found solutions statewide. But yes, that warm handoff is beautiful.
Okay.
Didn't, and we don't have time to get into why people are using, because from my work at the college, in alcohol and drug prevention there, we would do student wellness surveys, and every year just increasing numbers of kids that were using to cope with stress, pressure, anxiety, depression. And then with that, there's a lot of loneliness. So at the Connection Center, we think a lot about these the social determinants of health. And I think what seems to work in my experience is when we address all those issues, and that goes back to the collaboration that is so important. At the Connection Center, we have over 20, so to speak, vendors that we work with all the time to give referrals. And sometimes it's a phone call. We try to make it as warm of a handoff as we can. It's usually just not a piece of paper or an email, but and like I said, Hope Inc. is one of our top go-tos. Coalition for Compassion and Justice, Catholic Charities. We work with them pretty closely on a regular basis. And again, I think there's a synergy that happens when we're doing this work and they're doing this work, and we're all kind of doing the same work, working together. When we partner, collaborate, share ideas, share information about what's working and not working, I think that's when we do our best work. And I think that's when the public benefits the most from what we're trying to do.
You're absolutely right. And, advocates, many of us were instrumental in getting Hope up here and pushing for years, and we could have had it a long time ago. And there's still a lot of restrictions as to what they offer, and but that's something for another day. But Lillian, I would like to put you on the spot. May I do that?
Yes, you may, Kathy.
So I just keep hammering everyone about family support and the problems with referrals. I don't know if you can address it up here on some of the challenges and what FIC has to offer and why it's not being utilized.
Okay, so we have a site in Prescott Valley. We have one in Flagstaff. We have a site central, and we have a site in Tucson. And so the goal here is to offer to families, can I say that ray of hope? Because we are family run, and we are able to support families in saying that we have been in your shoes, first of all. And so we are very empathetic of the journey that you're on, whether it's physical, emotional, behavioral, whatever the need might be, but that walking with them side by side as they navigate the systems of care, whether it be for the children's side or whether it be for the adult side. We are always looking for support or information from the homes as to, we have this family, they have substance abuse, they have mental issues, They have domestic violence, you know, the whole array of services of what families are being challenged with. Therefore, we're able to develop a plan, a crisis plan, but a support plan, teaching families the importance of setting a goal and taking steps to obtain to meet those particular goals. We meet, whether it be virtual, whether it be in person. People are still reserved somewhat, Kathy, of us going into the home or sometimes even meeting at a Starbucks. Whatever the case might be, we are able to very creatively, I think, be able to support families as they navigate support for their families. I know we make a difference in family support for families. So if people are interested, they can go on our website, Family Involvement Center. All the information is there, the call that needs to be made, and we do the warm handoff. In fact, our Parents Assistance Center is actually called a warm line, Monday through Friday from 8:30 to 5. People are able to call, and we do make a difference. Thank you, Kathy.
Can I ask really quickly, so how do families typically find you? Are they referred to you from
Most
crisis units? Are they, how are they getting
a
to you?
combination of a lot of different things. Sometimes they'll hear from a neighbor, sometimes the school, sometimes the behavior health. It just all depends. So we get referrals in all facets as you have asked, just all over.
Well, the other thing that I'm wondering, are you familiar with trauma lens care?
No, I'm not.
Okay, so I wonder because there's an app aspect to it. There's also a podcast for interviewing. I'd like to get you connected to something that I think could be a healthy connection. Plus, I'd like to get some more. So when you say you have a place in PV, is where?
It's right near the connection of 169 and 69.
Yes, I was going to say, Kathy, I don't
Got
know
it.
the exact address off the top of my head, but right off
Okay,
that
I know
highway.
what
Yes.
you're talking about. And then,
Yes.
so the website, what do you know what the website is? Is it
Excuse me,
the web
Family Involvement Center?
.com?
Yes.
Got it. Okay.
And my name is Lillian Armstrong,
Uh-huh.
or Lillian@familyinvolvementcenter.org.
I'm going to connect you to.
Please.
Okay, and
Yeah.
let's go forward.
Because I'm also thinking about also with the Family Resource Center, and I'm thinking about some of the other agencies that I'm with that
Okay.
Yeah, there's a missed opportunity, I believe there. I'd want to find out some more, but I understand the concept of what you're saying.
Sure.
And yeah, I believe it's absolutely necessary.
My pleasure. Thank you.
Awesome.
I've known Lillian for 20 years.
So we want to capture the missed opportunities and let them be opportunities. I'm hoping that FIC will have a table at the event in Prescott, the celebration on the 28th. And I don't know if James, with his connections, to know who's been invited or who's handling that. We're planning on being there, but there's an opportunity to connect some of these that may not have been involved or know of each other previously. So
Do you have a flyer? Do you have
I
a flyer for this event?
I
Or just
do.
send-
No, I do. I have sent it out, but I'm not the organizer, and the flyer I have just says when and where it is.
This, if I have that information, we can get somebody maybe up north. You said the 28th of this month?
Of September.
Oh, September. So that gives us enough time. If you will send me that information,
Yeah,
I actually
Kathy, send me Lillian's email address and I will
Right.
get that.
Okay.
Thank you.
Yeah,
So
I
we
coordinate all. Thank
oh,
you.
good. Got the right person there. Okay.
If you don't mind if I mention also on September 28th, there's another event, which is I belong to the Committee for Suicide Prevention for Yavapai County, and there's the Out of the Darkness Walk. Happens every year in Granite Creek Park. I'm going to be emceeing that event and also speaking on behalf of losing a close friend to suicide. So I could get you some information on that, but that's also on September 28th.
Thank you, Lou. And I have sent flyers out for both of those events. And I don't, but it was my interpretation, may be wrong, that the event to be tabling at is the celebration event. Will there be tabling for exhibitors at the walk also?
There is, yes.
Oh, so we
Yep.
should be at both places.
Right, and I can give you the contact information for the person that's coordinating that.
Okay, all right, thank you. So at this point, we're closing in on time. I'll let Kathy thank the presenters. And after
Well,
that,
thank you. You guys were absolutely wonderful. I learned a lot, and I'm very excited about this conversation and want to continue it. And I think right here, a lot of networking took place.
Yeah.